Now, death by hospital. The O'Farrell government is promising culture change and clinical practice reform in the care of children admitted to hospital. This arose from the Garling inquiry into clinical failure surrounding the 2005 death of Vanessa Anderson, 16, at Royal North Shore Hospital. Last week, with some distressing similarities, a coroner found multiple clinical failings leading to the death in 2009 of another child, Jacob Belim, first admitted to Liverpool Hospital. Neither child's condition was considered life-threatening on admission, but they did not survive the hospital. Outside the coroner's court last week, grieving parents Yvonne and Emmanuel Belim.
All children should have access to an ultrasound, whether they have history of abdominal pain or current abdominal pain. We should never have been denied that from Liverpool Hospital. And then lastly, any child who does have surgery should have an ICU review immediately, or at least an hour after, not wait for doctors to decide or forget to write it down or go on a lunch break. This is our right. It's the last place to go. Hospital's the last place to go.
Jacob Belim, 8, died of septic shock on the operating table at Westmead Children's 24 hours after his appendix burst. Deputy State Coroner Scott Mitchell has found that although Jacob's GP had accurately diagnosed acute appendicitis, no one at Liverpool Hospital, where he was first admitted, took notice of the GP's referral notes. Jacob's condition was misdiagnosed as a bowel obstruction. He was left in a dehydrated state and not given adequate antibiotics. Eventually, in agony, he was moved for emergency surgery at Westmead, but it was too late.
There was a miscommunication in the sense that the GP, who was extremely diligent and made the diagnosis promptly, wasn't aware that Liverpool Hospital could not offer paediatric surgical services, and the ambulance did not know either.
We learn a lot from these sorts of things. We're not hiding from the fact that a child's died in hospital, and I think it's important, though, that we do look at it very carefully, as the coroner has done. He's given us some very good suggestions on what we could have done differently, but most importantly, over the last couple of years, we've already made most of those changes.
He was a beautiful boy. Yeah, the system failed us, you know. It shouldn't have happened. You know, what do you send your kids if you can't trust the hospitals?
Jacob Belim died in March 2009. It was the same month that the New South Wales Parliament voted on party lines to reject a private member's bill called Vanessa's Law, which would have made it mandatory that a child admitted to an adult hospital be seen by a specialist paediatrician within 24 hours. It was introduced by then opposition health spokesman Gillian Skinner. Sitting in the public gallery was Warren Anderson, the father of Vanessa Anderson, who at 16 died at Royal North Shore Hospital in 2005. Admitted for observation and treatment of what should have been a non-life-threatening condition, a depressed skull fracture from having been struck by a golf ball, Vanessa died in hospital. A coroner found a litany of clinical failings, including inappropriate and excessive levels of medication for pain relief, leading to respiratory collapse. Galvanised by this case, the then government appointed lawyer Peter Garling, an expert in medical cases, to look at systemic failure. His Special Commission report into acute care services recommended sweeping reforms to clinical culture, attitudes and teamwork practices.
Can I just say, I've maintained composure through Vanessa's tragedy.
Yes. But for Warren Anderson, the circumstances surrounding the death of Jacob Belim were emotionally overwhelming.
The irony of it is that I lost my composure more reading his findings than I did with Vanessa's, purely because Vanessa's findings were so similar to Jacob's that it meant to me, and that where I thought there'd been change with what had happened to Vanessa, there hadn't been.
Warren Anderson has identified these similarities in the circumstances leading to death by hospital in the cases of Jacob Belim and Vanessa Anderson. Both were admitted to inappropriate adult hospitals. Both were admitted on the weekend. Because both patients' conditions were considered non-life-threatening, there was no real sense of urgency, leading to complacency with a greater risk that danger signs would be ignored.
A weekend with a patient that is not in a life-threatening condition is a very, very dangerous place to be in a hospital. With Vanessa, she was never unconscious at any stage as a result of the injury itself. And, you know, you look at that and to me, that's a breeding ground for complacency.
Miscommunication among clinicians. In Jacob's case, his GP's accurate diagnosis was ignored. In Vanessa's, CT scans were misplaced. Inappropriate treatment. In Vanessa's case, inappropriate and excessive pain relief. In Jacob's case, misdiagnosis in spite of the parents' plea that he was suffering acute appendicitis. In March 2009, Warren Anderson saw the Parliament of New South Wales reject Vanessa's law.
The issue for me is having something legislated. I put this similarly to seatbelts. Seatbelts were recommended that everyone wears a seatbelt because it saves lives. Did everyone wear a seatbelt? No. When did they start wearing a seatbelt? When someone became accountable.
Now, Health Minister Gillian Skinner says she will not be reintroducing Vanessa's law, even though the Coalition has an election mandate from the people of New South Wales so to do.
I'm making a commitment to the people of New South Wales that I'll introduce something better and stronger than Vanessa's law in considering the establishment of New South Wales Kids. It will be legislated. It will have some very important and expert people involved with it.
The New South Wales Kids reform was a recommendation of the Garling inquiry. It will establish for the first time a statewide Children and Young People's Health Authority. An expert group, including this state's top paediatricians, will report on its formation by the end of the year. But as Warren Anderson continues to ask, what about accountability?
Don't forget there is now a mandatory requirement for people to report clinicians they deem to be incompetent. You know, how many have been reported is another thing, but there is a mandatory requirement and it is legislated.
While we wait for hospital staff to report clinicians whose negligence or incompetence could compromise patient safety, and Minister Skinner's new Kids Health Authority, Warren Anderson has this advice for parents taking a child to hospital for admission. Demand to be listened to. Make sure the referring doctor's notes, if any, are read. Question the diagnosis. Question the treatment options. Ask if pain relief can mask the accuracy of diagnosis. Demand a paediatrician make an assessment as soon as possible. Never leave the child's side. Always remember, they don't mean to, but hospitals can kill you.